We saw over the weekend the first positive case from a test at the hospital, and so maybe Jeff or Dr. Underwood, if you could take us maybe through how that happened. The test was done on Wednesday, and then the results were released on Saturday?
That's correct, Scott. It was an individual who came through our external assessment area this past Wednesday. What we know is that public health officials have deemed it to be a travel-related exposure, and that individual is not hospitalized. At home on self-isolation protocol.
Very good. And this is part of why you are doing these external assessments. Is that correct?
Right. We want to help those who are truly symptomatic identify if they've been exposed, and then they can take appropriate precaution for themselves and their family.
And again, I know the hospital's been sending out updated information, Jeff Bourgeois and Dr. Underwood, about these external assessment and the areas and the times that you'll be doing this. And again, you've got 3 times set up, I believe, this week again, correct?
That's correct. On today, it'll run from 10 a.m. till 2 p.m. And the same times on Wednesday and Friday of this week.
And just for folks who are listening and watching us, the area that we're talking about, it is outside of the hospital. It's kind of away from the emergency department, kind of along Pinion Street there along the back side of the hospital, if you would, right?
Correct, south side of the hospital.
There it is. And so, again, and you're asking for folks to come through. It's kind of a drive-through situation, right?
That's correct. And Scott, we're really only encouraging those that are truly symptomatic to come through. We have to preserve our resources, which include the collection kits for people who screen in to be tested, as well as preserve the personal protective equipment that our staff is wearing in that circumstance out there at the external assessment area.
Right, certainly. I will let Megan Cullip join the conversation here. I didn't mean to ask all the questions, Megan. But
well, I do have one important question,
yes,
which is, how would I know if I was symptomatic? What are those symptoms?
So primarily what we're looking for is fever in addition to body ache, cough, and shortness of breath. Those are the standard ones that if you go to the Department of Health website, if you go to the CDC website, those are the primary symptoms that we're looking for.
Great.
Gotcha. There you go. And again, those will be 3 times this week. You've got that open for folks in the community, right?
Correct.
Very good. Well, gentlemen, I appreciate you coming in. Is there anything else that we should be sharing with the audience about how the hospital is responding? I imagine for all of you, this is something that's kind of uncharted territory, right? I know you train for mass events, but this is a little bit different, is it not?
Yeah, no doubt. Scott, I'd just like to ask the community to support their caregivers here at San Juan Regional and our entire community by just paying attention to all the warnings and advice that are out there on any website related to COVID-19 about appropriate social distancing and everything that goes along with washing your hands and covering your cough and sneeze. I do want to let people know that it does take oftentimes 3 to 7 days for us to get a result back. The 4 labs in Albuquerque that today are able to result these tests for us are running at their capacity as well. We do not intend to frustrate anybody, nor do they, with the amount of time that it's taken to turn a test result around. So be patient, be calm. If you are at all concerned, self-isolate, practice all the advice that's out there. And Dr. Underwood did have really, let me anticipate one more question. So, Dr.
All right.
Underwood, if we're telling people to stay home, at what point should they call their doctor or seek further care?
The primary thing that we're looking at to stop self-isolating is really that shortness of breath component. That would be a point at which we think that you ought to call your primary care physician and ask further guidance. Otherwise, with the milder symptoms, staying in home and self-isolating is really the primary choice. In the end, it's a virus. There is no proven treatment for it. There's no vaccination for it. And so supportive care, self-isolation, washing your hands a lot, using sanitizer on your hands, all of those are still strongly, strongly recommended.
Makes sense. And of course, as you both have mentioned, though, these test results do take a couple of days. It's possible if you were positive and you're not isolating, you could be unknowingly maybe infecting others around you. And that's why this social distancing and self-quarantine is so very important these days, correct?
That's exactly right. We like to say prepared, not panic. We strongly urge everyone to remain calm, but at the same time, take all the advice extremely seriously. We need to protect ourselves and protect those around us. So don't underestimate the importance of following all the advice that's out there around social distancing, hand washing, etc.
And further to your point, Scott, is that especially younger people may have only minimal symptoms, yet they're still shedding the virus and potentially passing it on to others who may be more vulnerable. You've all read the news that it's the patients that have significant other medical problems that may be at risk, and the elderly. Younger people are often not as symptomatic, and they may be shedding the virus and conferring it to other people unwittingly, and that's really where social distancing comes in, to make sure that we're not interacting and sharing the virus with people when we don't even know we have it.
Very true. Well, gentlemen, I appreciate you being with us. We're opening the phone lines to our viewers who might want to call in with a question that we haven't asked either, and that is 566-3909. 566-390.9, everyone, if you would like to call in, or if you're watching our Facebook live stream, you can ask a question on Facebook, and it should pop up here in the studio, and we should be able to answer that. But again, gentlemen, if you would certainly extend all of our gratitude to your staff and the folks that are working at the front lines there at San Juan Regional Medical Center. We certainly appreciate all the work that they're doing. I imagine it is a lot of uncharted territory, as I've already said.
Certainly is. Scott, can I put a plug in for the blood drive that will be held at the hospital's main parking lot this Friday?
Yes.
This Thursday.
Thursday blood drive. Yes, because we've heard that there's a shortage, so thank you.
Yeah. 6 a.m. to 6 p.m. We'll have a mobile unit out in front of the hospital in the main parking lot. We ask that donors schedule appointments online by going to www.bloodhero.com. Then clicking on Locate a Blood Drive. You can search by date and zip code, and that will allow, and then the donor can answer a few questions that will help them screen in for eligibility to donate blood, and then that way we can manage the crowd at the mobile unit. As within the unit itself, they'll be practicing social distancing, so limiting the number of donors that can be in their mobile unit at any one given time.
That's great. Well, again, that's going to be on Thursday, beginning at 6 a.m., you said.
6 a.m. through 6 p.m. Yes, sir. Thursday, March 26th.
Okay. All right. Very good. And as far as other things at the hospital go, gentlemen, I mean, are you still able to do elective surgeries or some other things or things along that line, or are those kind of on a case-by-case basis?
That's actually right. It's on a case-by-case basis. We have put out a policy with the physicians all being united behind this of stopping elective, and of course there's a lot of caveats in what is really elective procedures to be done at the facility. Anything that can be postponed without significant harm to the patient will be. So we have a review team of providers that will look at cases that are being proposed to be done to look at will it be a delay in a diagnosis, or is there a pain element that it needs to have a procedure done right away, or is there risk of life or limb to the patient if they don't have the procedure done. But otherwise, elective procedures, simple diagnostic screenings, for example, those will be postponed until we get to the other side.
I have one question regarding that. Is that primarily to save medical equipment, or is that because there's a higher risk of catching something?
All of the above are true. Of course, preserving our protective equipment, our PPE is what we call it, is one of the things that we've heard across the country. We're not in that position, but we don't want to get there right now.
Got it.
So that was one of the first considerations. But yes, there will, like anywhere else, we're trying to avoid crowds and congregating of people into a common area. And although we have good, what we call ingress and egress from our surgical area, we still would like to decrease that contact of individuals with the possibility of conferring the disease to each other.
Very good. And I know there's something else we're going to talk about this morning, Megan Cullip, and that is some folks in the community are trying to maybe put together some protective masks and things
Yes.
like that may or may not be hospital quality. But while we have folks from the hospital on the line with us, is there anything that folks could be helping to provide to the hospital that they can help with?
Well, right now we have one local company that has a bank of 3D printers. They are exploring their ability to make face shields for us.
Okay.
There's been some successes in pockets around the country where that's happened with the 3D printing technology. I'm working with a board member who is kind of coordinating communications to a large community group who's interested in making masks for us. And we are still pending a validation of what is the best material to use. There's limited research on this, but there is some out there. We want to make sure that if our great community steps up to support us that way, we can have their efforts be of the greatest value. So we're almost at the point where we can turn that group loose to start making masks for us. But in the meantime, know that we're taking steps internally to preserve what we have or conserve what we have, and we have an emergency supply through our disaster preparedness materials, and so we're in no imminent danger of running out of personal protective equipment. We are just trying to prevent getting.
Well, it's an important thing, and we're all in this together, as we have said time and time again. So we're glad to be able to do this, and so I thank you all for taking time out of your day to join us this morning, gentlemen. Thank you.
The community coming together from our perspective has been really great. So thank you.